Next talk by Dr. HRIDYA Mohan, and discussion for this talk Dr. Ajay Sharma.
Dr. Ajay. Good afternoon, everybody. I'll be presenting my video, Cystotome phaco chop.
Dr. Prasanna, are you there? Please start.
Cystotome phaco chop. In this novel technique, the 26-gauge cystotome, which is regularly used for creation of capsular excess, is also used for rotation of nucleus and also chopping of nucleus. The sharp tip of the cystotome makes it an excellent chopper. Here, chopping is performed within the confines of a rhexis margin, so that the sharp tip of the cystotome does not cut through the rhexis margin. Once the nucleus is chopped into multiple fragments, these fragments are emulsified as in regular phacoemulsification. This is the cystotome chopper used in the previous shown case. It's comparable to a short chopper, but when compared to the long chopper used in dense cat rats, the cystotome regular chopper is much smaller. In order to create a longer cystotome chopper, a 26-gauge needle can be bent a little away from the tip at the bevel. This gives adequate length to the cystotome chopper. Now it's comparable to the long chopper used in cases of dense cat rats. Here I have created a long cystotome chopper, and it is used for chopping of this mature cat rat. This is another case of a dense brown cat rat with a leathery posterior plate.
That's good.
The long cystotome chopper is pretty effective in getting through and through crack in the center. Once a central crack is obtained, multiple cracks are again made using the long cystotome chopper. Once the nucleus has been chopped into multiple fragments, each of the fragments can be removed effortlessly. And there is no attachment in the center. Cystotome chop is an efficient technique in nucleus disassembly. It's cheaper alternative, and it is more useful in denser leathery cat rats and helps in attaining full thickness cracks. Thank you.
Dr. Ajay Sharma, please. Dr. Prasanna, get ready.
Hello. Yeah. So you've used the same 26 gauge needle here,
Yes, sir.
and which is readily available.
Sorry, sir.
Which is readily available, the same
yes,
needle you have
the
used.
same needle that is
Then
readily
the
available.
second thing is, I think it needs a lot of learning curve, because here the chopper, what you're chopping is not direct. You know, it is a sort of a because it is bent, needle is bent. You have to bend the it is, and it has to be a sort of a horizontally it is bent. So, and you are doing more of a vertical job, so you can't use it for horizontal
No,
chopping.
sir, it cannot be used, but it should be within the confines of the rexus margin.
Yeah. So, how do you feel the learning curve? Because I think this is for someone who is very expert in doing a phaco surgery, and why would someone need to do a thing like this and not have a chopper instead? That is my question.
For me, from my personal experience, for me, leathery cataracts, dense Brunison cataracts with leathery plate, I find it a little difficult with choppers even, sharp choppers even. But somehow with the cystotome chopper, I feel because of the sharp tip, it's and multi-level, multi-planar holding, the through and through cracks, I'm able to get it better with the cystotome choppers, longer cystotome chopper. I feel it's more useful for dense and Brunison
The
cataracts.
tip again is very sharp, so it can cause a
One needs to
pissarate.
be
Yeah.
careful, sir. Yeah, one needs to be
Yeah,
careful when
I
using.
used to use this in 2003.
Yes, sir.
Now, problem with that, you have cutting edge in the side as well. And once it touched the capsule, it got to the posterior and I had a nucleus drop and I stopped. I think when you have good choppers available with side cutting chopper, the side cut of the needle is not required. So this,
So when there are more cases posted in the OT and sometimes when the chopper is not
no, a
working.
chopper is handy rather than you are wasting time in bending the needle.
Yes, sir.
Yeah. And I gave up after the nucleus drop.
So I had one case of rexus tear using this cystotome chopper, but then I converted the case to
Yeah,
SICS.
because you have the cutting edge of the needle
Yes.
on the side.
Yes.
The moment it touch, it will extend.
Thank you, Dr. HRIDYA.
Thank you, sir.
Please